Hello, the internet. We are on our usual Friday lunchtime walk with the Ginger Ninja. Just thought we'd have a bit of a roundup on what's been going on in the world of learning disabilities and health and general bits and bobs. So noticed earlier in the week the mother who suffocated her autistic son was sentenced this week. Again, I think I commented earlier on that completely tragic story, and I think a lot of people can sympathise with the stress and futility of feeling alone and isolated that lockdown brings. However, having said that, it's certainly no excuse to go killing people, autistic or not. So yeah, an interesting one. But yeah, moral of the story is, don't go killing people in my eyes. Second thing that we spotted, again probably broke about Tuesday, Wednesday, there's a group of people in Scotland who had come together to call for a Scottish Commissioner on Learning Disability and Autism to try and raise a profile and look at enacting some laws that could affect how councils distributed money and worked. I think it's a good idea. Anything that we can get to improve the recognition of the needs of people with disabilities and get somebody on a commissioning level who has that specialist knowledge. It's a shame, again, a bit like my role as a specialist physio, that these values and understanding of those needs aren't mainstream as they should be. They're written enshrined in law that they should be, but proved yet again that they're not. What else have we had? There was a PCPLD webinar, the group of self-advocates and notable healthcare professionals. Webinar hosted talking about vaccinations and people with learning disabilities. I didn't get a chance to get on there, but I had seen some tweets and I did manage to watch part of it back afterwards. I think that it was... I don't personally know what more information people in charge of vaccination programs in the UK need in order to give people with learning disabilities access to a vaccination. As I tweeted, there isn't another demographic that has had the mortality rates that people with learning disabilities have had and have not been prioritised. I get that people with Down syndrome and people with PMLD have been prioritised, that's a good thing, but the mortality rates take into account all people with learning disabilities. There was also, made a little list this week, quite a few bits going on. NHS England released some data today, it might have been yesterday actually, I saw it today, looking at the aggregate data from the year 2019 to 2020. Come on, good girl. On general health around people with learning disabilities. Some cherry-picked stats. I should also mention that this is aggregate data. I've been asked to caveat it. Come on, you. Saying that this doesn't take into account coronavirus pandemic, but in the year 2019 to 2020, on GP registers, we know that the prevalence in the UK is between 1 and 2% of people with learning disabilities. GP registered had, it's estimated 1 to 2%. GP registers had about 0.5% of their patients registered as having a learning disability, so quite a lot of people being missed. There was an improvement on the stats around people who'd had a healthcare check. So people with learning disabilities are entitled to an annual healthcare check. It's been creeping up over the last years. I think there's figures just before last were about 51%-ish. In 19 to 20, the figures are about 57%, so there's an improvement. I think we'll take any improvement we can at the moment, but is it good enough? Still, not really. We can do more. Some interesting figures, that a third of patients who were able to access and have a smear test with learning disabilities had them. So a third of eligible women with learning disability access to smear test in 2019-2020. When you compare that to nearly 3/4 of people without a learning disability. Again, a lot more can be done. A lot more can be done. And finally, I saw that today, as we speak, the Oliver McGowan mandatory training for health and social care staff is being rolled out. There's been a trial going on today. I believe it was the autism module. So, you know, big shout out to Paul McGowan for finally getting that off the ground. Again, it's a trial and not things working fully, but it's a start. And let's keep spreading that message around accessible healthcare. Other than that, on a personal note, had some press releases that went out earlier in the week around the movement for movement slide set work that we've been doing, and it was really nice to, you know, revisit that topic a couple of months after the work was published. There was a slight error in the figures that first went out, saying it was 150,000 students per annum. It's actually around about 120,000. We have put out a statement correcting that, but it's been picked up by a couple of local media outlets. So really nice to get shine a bit of light on that, and, you know, get a bit exposure for what the movement is about and what, you know, what the advocacy work is around, because it's about spreading the message to as many people as possible. So I think that's everything. Hope you all have a nice weekend. Thanks again to those who are in front line. Let's keep getting out there, keep spreading the message, and I'll see you all again soon. Bye.